Back pain doesn't kill, it tortures, destroying lives and livelihoods. It accounts for half of all chronic pain and is the leading cause of sickness absence from work. The financial burden of back pain is enormous. Every day it costs the National Health Service £1.3 million. Every day it costs £13 million in disability benefits. And every day it costs the UK economy £37 million. That's a staggering £19 billion every year. Backcare is the UK's National Back Pain Association. It was founded over 40 years ago in 1968 by an industrialist, Stanley Grundy CBE, who suffered back pain but was dissatisfied with the lack of support he found available. The charity's mission is to lessen the burden of back and neck pain on sufferers, their families, the National Health Service and the economy in general.
Around 30 million adults in the UK will suffer back pain this year. Of those, 10 million will still be in pain in 12 months, and 6 million will have been out of work for 3 months or more as a result. But one of the largest challenges that we face at Backcare is that society in general doesn't really recognise the full scale and impact of back pain. And so we find ourselves essentially championing an invisible cause. The way that we combat this is through our educational campaigns. One of our largest educational campaigns to date has focused on excessively heavy school bags and the impact that this has upon the spinal health of children. This year we're launching a new campaign focused on the construction industry, which generates 30,000 new back injuries every year. And because we're passionate about our campaigns, we've teamed up with world leaders in manual handling training.
To provide a solution, it's best to understand the problem. And we came across two major problems with manual handling in industry. First, the training was historically just too general. And secondly, full of myths and fallacies. For example, bend legs and back straight. Have you ever tried it? Because that's the perception. And they realised they couldn't do that, so they did what they thought was best, and it became a bit of a tick in the box. What we've been able to do is bring a new tool to the table, and it's based on Olympic weightlifting. You see, Olympic weightlifting is anatomically and mechanically perfect. And there's people my body weight now putting in excess of 200 kilos above the head. And if you think of the tonnage they shift on a daily basis, it's huge, without injury because they're technically sound. And what we've been able to do is bring that into industry with those principles and adapt them to any given situation or task. Consequently, it massively reduces the pressure on the body on a daily basis and therefore the risk of injury. But the best part is the buy-in from the staff themselves. Because the programs are so bespoke and very hands-on, they can physically feel the difference there and then. And you know, when you talk about this behavioural change, there's nothing focuses the mind like pain. That hurts me and that doesn't. So which way are they going to do it? So you can change bad habits to good habits. And that's so important. We have a multi-elemental approach with a behaviour change and a full support programme, and therefore zero accidents is doable. It's been done. For the construction industry, working with the HSE and a world-leading insurance company and now Backcare, we've actually tailored a programme where we brought these principles into every major task. And what that does will massively reduce the pressure on the body doing them, and it will reduce back pain.
The other major issue that we face at Backcare is resistance to change. We find this quite commonly amongst both patients and healthcare professionals. And if history tells us anything about the future, it's that science and knowledge is always evolving. So what's true today is almost guaranteed to become inadequate or obsolete by tomorrow. For example, 25 years ago, if you suffered from chronic back pain and were sent for an MRI scan, if the scan showed a herniated disc, this would be assumed to be the cause, and you'd almost certainly be referred for surgery. However, since then, studies have shown that herniated discs are a normal sign of aging and are almost equally common in people with and without back pain. It's for this reason that we have a very keen research interest, whether that's funding new research projects or simply working to raise awareness around new methods that are bringing new results.
I specialise in a pioneering approach to chronic pain that's based on an updated understanding. The acute pain of an injury is an unpleasant but important biological signal indicating tissue damage. However, we're beginning to understand that where there is no underlying physical disease, such as cancer or rheumatoid arthritis, chronic pain is actually created by the central nervous system, rather than the bodily location where the pain is felt to be. Therefore, by addressing the central nervous system directly via its software, or in other words, the mind, we can now achieve complete resolution of chronic back pain, no matter how severe or long-standing. This is a very different outcome from pain treatment or management-centred approaches, and has been borne out by case after case that I see in my clinic. Through my Practitioners Association, I now train health professionals to integrate this approach into their own work. And through our collaboration with Backcare, we're setting up a formal research study to demonstrate these results.
We depend upon the generosity of donors and fundraisers to make this all happen, and none of our achievements to date would have been possible without them. The best way to get involved is to become a member of the charity. We offer memberships for both patients and professionals, as well as corporate partnerships. Back pain strikes without warning. Tomorrow it could be you or one of your loved ones. Help us stop back pain from destroying someone's life today. Please send a donation or become a member.